Your blood pressure is higher than it should be. You may already know that. What you probably don't know is that something sitting in your kitchen right now, something you've been eating for years, something you may have eaten this morning, is making it harder for your body to bring those numbers down. Not a little harder, measurably harder. And your last appointment didn't cover this. I'm Dr. Elena Marsh. I've spent over 20 years in clinical medicine watching the same pattern repeat itself. A patient comes in with blood pressure numbers that won't budge. They're already on medication. They're already trying. And no one has ever sat down with them and explained what food actually does inside the cardiovascular system. Not in a general way, in a specific mechanistic way that changes how you shop, how you cook, and what you reach for at breakfast. Today that changes. I'm going to walk you through 5 specific foods, backed by published research, that have a measurable, documented effect on blood pressure after 60. Not supplements, not powders. Whole foods you can find at any grocery store, some of which you may already have at home. But more importantly, I'm going to explain why they work. Because when you understand what's happening inside your arteries, the choice to eat these foods stops feeling like a rule and starts feeling like common sense. Quick question before we go further. Do you check your blood pressure at home or only at the doctor's office? Write home or doctor in the comments right now. I read every single one, and your answer will matter by the end of this video. Before we get into the foods, I need you to understand one thing about blood pressure, specifically about why it becomes harder to manage after 60. It comes down to your arteries. When you were younger, your arterial walls had a quality called compliance. They could expand and contract with each heartbeat, absorbing the pressure wave, distributing the force. Over time, a process called arterial stiffening begins. The smooth muscle in your arterial walls becomes less elastic. Collagen deposits accumulate. The vessels that were once flexible begin to resist the flow of blood rather than adapt to it. This is why blood pressure in older adults often presents differently than it does at 40. You may see what's called isolated systolic hypertension, where the top number climbs, but the bottom number stays relatively normal. That gap between systolic and diastolic readings is called pulse pressure, and a widening pulse pressure is one of the clearest markers of arterial stiffening in adults over 60. Now here's where food enters this picture, and this is where most health content stops short. It's not just about sodium. That's the conversation your doctor usually has time for. Watch your salt. And yes, sodium matters. We'll come back to it. But the full picture of how diet affects blood pressure in your age group involves at least 4 distinct biological pathways. Nitric oxide production, the renin-angiotensin-aldosterone system, the balance of potassium and sodium at the cellular level, and systemic inflammation affecting the endothelium, the thin inner lining of every blood vessel in your body. Each of the 5 foods I'm about to share acts on at least one of these pathways. Some act on 2 or 3 simultaneously. And the research behind them isn't preliminary. It's published in peer-reviewed journals with sample sizes that matter. So let's start with the first one. Food number 1, beets. Not beet powder, not beet supplements, whole beets, roasted, steamed, or raw, or pure beet juice with no added sugar. Here's what happens inside your body when you eat them. Beets are one of the richest dietary sources of inorganic nitrate. When you chew beets, bacteria naturally present in your mouth convert that nitrate into nitrite. Then, once nitrite reaches your stomach and enters your bloodstream, your body converts it into nitric oxide, a molecule your endothelium uses to signal your arterial walls to relax and widen. This process is called vasodilation. And in adults with elevated blood pressure, the vasodilatory effect of dietary nitrate is not subtle. A meta-analysis published in the Journal of Nutrition in 2013, reviewing 16 controlled trials, found that inorganic nitrate and beet juice supplementation produced a mean reduction of 4.4 millimeters of mercury in systolic blood pressure. That may sound like a small number, It is not. A sustained reduction of 4 to 5 millimeters of mercury in systolic pressure is associated with a 17% reduction in stroke risk and a 9% reduction in cardiovascular mortality. One food, one biological pathway. Numbers that matter. Now, and this is important, the nitric oxide pathway becomes less efficient as you age. Your endothelial cells produce less nitric oxide naturally after 60, which is one of the reasons arterial stiffening accelerates in this decade. Dietary nitrate from beets isn't a supplement. It's a direct input into a biological system your body is already trying to use. It just needs the raw material. 2 to 3 times per week, half a cup of roasted beets or 8 ounces of pure beet juice. That's the threshold where the research shows consistent benefit. Food number 2, leafy greens, specifically spinach, Swiss chard, and arugula. The mechanism here connects to the same nitrate pathway. These greens are among the highest dietary sources of inorganic nitrate outside of beets. But there's a second mechanism at work that most people never hear about. Leafy greens are rich in potassium. And the relationship between potassium and blood pressure is one of the most clinically significant and most underexplained interactions in cardiovascular medicine. Here's what's happening at the cellular level. Your kidneys regulate blood pressure in part by controlling how much sodium your body retains. Sodium retention increases fluid volume. Increased fluid volume raises blood pressure. Potassium directly opposes this process. It signals your kidneys to excrete more sodium through urine, reducing fluid volume and, with it, arterial pressure. This sodium-potassium balance isn't just about eating less salt. It's about the ratio. Research published in the New England Journal of Medicine in 2021 from the Salt Substitute and Stroke study involving nearly 21,000 participants found that replacing regular sodium with a potassium-enriched alternative reduced stroke risk by 14% and major cardiovascular events by 13%. The potassium wasn't negating sodium. It was actively working against its pressure-raising effects at the kidney level. Spinach, Swiss chard, arugula, 1 to 2 cups per day, cooked or raw. This is not a wellness recommendation. This is a documented cardiovascular intervention. Food number 3, oats. Specifically, whole rolled oats or steel-cut oats, not instant packets with added sodium and sugar. The active compound here is beta-glucan, a soluble fiber that has been studied extensively for its effect on both cholesterol and blood pressure. But the blood pressure mechanism is separate from the cholesterol effect, and it's the one that rarely gets explained. Beta-glucan ferments in your gut, producing short-chain fatty acids. These fatty acids interact with receptors in your gut lining and your vascular system that help regulate blood pressure through the renin-angiotensin-aldosterone system. The same hormonal cascade your kidneys use to control how much sodium and water you retain. When beta-glucan activates these receptors, it damps down the system's tendency to hold fluid and raise pressure. A review published in the American Journal of Clinical Nutrition found that 3 grams of beta-glucan per day, the amount in approximately 1.5 cups of cooked oats, produced a statistically significant reduction in both systolic and diastolic blood pressure in hypertensive adults. 3 grams, 1.5 cups. Every morning. Here is the part most people watching this have never been told. Your blood pressure does not rise because your body is failing. It rises because your body is responding to what it's not getting, to what it's receiving in excess, and to decades of signals it was never given the tools to correct. The foods I'm describing are not substitutes for medication when medication is necessary, but they are inputs into biological systems that your body is already trying to use. Your endothelium is trying to produce nitric oxide. Your kidneys are trying to balance sodium and potassium. Your gut is trying to regulate the hormonal signals that control your pressure. These systems don't stop working after 60. They work with less raw material. You didn't know that. Now you do. Has your doctor ever explained the connection between these specific foods and your blood pressure numbers? Write never or yes in the comments right now. Your answer matters more than you think. We have two more foods to cover. And the second one is something most adults over 60 are already eating, but almost certainly not in the right form or at the right time. And then I'm going to give you a specific named protocol for how to use all 5 of these foods together, starting tomorrow morning. Stay with me. The protocol is next, and it's the part that makes everything you've just learned actionable today. Food number 4, berries, specifically blueberries and strawberries. This is the one most adults over 60 are already eating, but almost certainly not in the right amount, and almost certainly without understanding what's actually happening inside their arteries when they do. The active compounds here are called flavonoids, specifically a subclass called anthocyanins, which give blueberries and strawberries their deep red and blue pigmentation. These aren't antioxidants in the vague, general sense you've heard about for decades. They have a specific documented mechanism in the cardiovascular system. Anthocyanins directly stimulate the production of nitric oxide in your endothelial cells, the same vasodilatory signal we talked about with beets, but through a different upstream pathway. They also reduce a compound called endothelin-1, which is one of the most potent vasoconstrictors your body produces. When endothelin-1 is elevated, as it tends to be in adults with chronic hypertension, your arterial walls stay in a state of partial contraction. Anthocyanins suppress that signal. The evidence here is substantial. A study published in the American Journal of Clinical Nutrition followed over 34,000 women over a 14-year period and found that those with the highest anthocyanin intake had a 12% lower risk of developing hypertension compared to those with the lowest intake. That's not a short-term blood pressure measurement. That's a 14-year protective effect from a dietary pattern. 1 cup of blueberries or strawberries per day. Fresh or frozen, the anthocyanin content is comparable. This is not a large amount. It is a consistent one. Food number 5, garlic. Raw garlic, specifically, or aged garlic extract if raw garlic is difficult for your digestion. And the timing matters here in a way that most people never consider. The active compound in garlic is allicin, which forms when you crush or chop a garlic clove and allow it to sit for 10 minutes before cooking or consuming it. That 10-minute window is when the enzyme alliinase converts alliin into allicin. And if you skip that step and throw the garlic straight into a hot pan, you destroy the enzyme before the conversion happens. You get the flavor. You lose most of the cardiovascular benefit. Allicin works through 2 blood pressure mechanisms simultaneously. First, it directly promotes nitric oxide synthesis in the endothelium. Second, and this is the mechanism almost no one explains, it inhibits an enzyme called angiotensin-converting enzyme, or ACE. You may recognize that term from a class of blood pressure medications called ACE inhibitors. Garlic, through allicin, works on the same biochemical target, naturally through diet. A meta-analysis published in the Journal of Nutrition in 2016, reviewing 12 randomized controlled trials, found that garlic supplementation produced a mean reduction of 8.3 millimeters of mercury in systolic blood pressure and 5.5 millimeters of mercury in diastolic pressure in participants with hypertension. These are clinically meaningful numbers. In the same range as low-dose antihypertensive medication, 1 to 2 cloves per day. Crushed or chopped, rested 10 minutes, then added to food. Every day. Now here is exactly what I want you to do, starting today. I'm going to give you a framework for using all 5 of these foods together in a way that's sustainable, simple, and calibrated to how your cardiovascular system actually works throughout the day. I call it the Daily Pressure Defense. 3 steps, starting tomorrow morning. Step 1. The morning nitric oxide window. Time Within 30 minutes of waking, your nitric oxide production is at its lowest point in the morning. This is part of why cardiovascular events cluster in the early morning hours. Your first nutritional task of the day is to begin restoring it. Eat 1 cup of cooked oats, steel cut or rolled, not instant, with half a cup of fresh or frozen blueberries or strawberries mixed in. This combination delivers beta-glucan for the renin-angiotensin system and anthocyanins for endothelial nitric oxide production simultaneously. 2 pathways activated before 8 a.m. If you prefer beet juice, 8 ounces of pure beet juice alongside your oats accomplishes the same nitrate loading that the Journal of Nutrition meta-analysis identified as producing a 4.4 millimeters of mercury reduction in systolic pressure. You don't need both the juice and the berries. Choose whichever fits your morning. This step takes 4 minutes to prepare. That is the investment. Step 2, the midday potassium reset time. Lunch. Your kidneys are most active at regulating sodium excretion during the middle hours of the day. This is when dietary potassium has its strongest effect on the sodium-potassium balance at the cellular level. Build your lunch around 1 to 2 cups of leafy greens, spinach, Swiss chard, or arugula, raw in a salad or cooked down. The potassium content doesn't change meaningfully with cooking. Add 1 to 2 cloves of garlic to whatever protein or grain you're eating alongside it, crushed 10 minutes before it hits any heat. This step requires no special meal. It requires adding 2 ingredients to what you're already eating. Step 3, the evening pressure stabilizer. Time, dinner or within 2 hours before bed. Blood pressure naturally rises in the evening in adults with hypertension, a pattern called non-dipping, which is associated with higher cardiovascular risk than daytime readings alone. The goal of this step is to give your vascular system one more input before the overnight hours. Add half a cup of roasted or steamed beets to your dinner plate 2 to 3 times per week. On the other evenings, a second serving of leafy greens achieves similar potassium loading. Either way, you are giving your endothelium the raw material it needs during the hours when your blood pressure is most likely to stay elevated when it should be coming down. This is not a rigid meal plan. It is a framework built around the biology of when your cardiovascular system needs these inputs most. You came into this video knowing your blood pressure was a concern. You're leaving with the science behind 5 specific foods, 4 distinct biological mechanisms, and a 3-step daily framework you can start tomorrow morning. That cost you 20 minutes. Use them. Your body has not stopped responding to what you give it. Your endothelium is still producing nitric oxide. It just needs the raw material. Your kidneys are still regulating sodium. They just need the potassium to work with. Your renin-angiotensin system is still listening. It just needs the beta-glucan signal to quiet it down. The daily pressure defense is not a diet. It is a set of daily inputs calibrated to the way your cardiovascular system actually works after 60. 5 foods, 3 moments. Every mechanism that matters. Covered. This is the information your last appointment didn't have time for. You have it now. There is someone in your life, a spouse, a sibling, a friend, who is managing blood pressure right now and has never once heard the words endothelin 1, nitric oxide, or ACE inhibition in the context of their breakfast. This video can reach them before the morning it matters most. Share it with them today. Not for this channel. Because what their doctor never had time to explain is right here, and it's free. If you haven't subscribed yet, please do that now. Every week I bring honest, research-based information about what your body needs after 60. The information I wish every patient had before they ended up sitting across from me. Subscribe so you don't miss what's coming next. Everything I've shared today is based on published research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medications, diet, or daily routine, please speak with your own doctor first. They know your history. Bring this information into that conversation. That's exactly where good medicine begins.